test quickly starting, that is readily available, that people can do at home, so you can take the test, know where you are, and we can start ending this terrible situation that we're in. Also, you come up with testing and rapid testing. Not only do you get up and get the economy running, you end the anxiety. The anxiety is what is most oppressive here. Not knowing if I'm positive, if my friend is positive, if my loved one is positive, not knowing when this is going to end. The anxiety of dealing with this isolation day after day after day. It's like a bad Groundhog movie, you know? Day after day after day. When does it, how does it end? I don't know. I'm out of control. I think the testing is going to be the best mechanism to try to work through that. On the good news front, we have new testing available in New York. Regeneron, which is a great New York company, has created 500,000 testing kits at no charge. Thank you, Regeneron. And they are distributing them across the state. Corning, another great company, has donated 100,000 tubes and $500,000 at reduced cost, so we can do more tests. New York is very aggressive on testing. We have been from day one, and we think that has helped us slow the spread of this virus. My favorite topic, young people must get this message. They still have not gotten the message. You still see too many situations with too much density by young people. They can get it. They're putting their lives at risk. This can kill young people, rare circumstances, but it can. But you get infected, you give it to someone else. So think about somebody else. And I've said this 100 different ways. The compliance is still not where it should be. You saw the models on the differential in the compliance versus major compliance and minor compliance. So we're going to take more dramatic actions. We are going to close down the New York City playgrounds. I've talked about this for weeks. I warned people that if they didn't stop the density and the games in the playgrounds, you can't play basketball. You can't come in contact with each other. That we would close the playgrounds. I've spoken to Speaker Johnson from New York City, who feels very strongly about this, who did from day one. We agreed initially with the mayor that we would try compliance, and the mayor was going to try to use the NYPD to enforce compliance, social distancing in playgrounds. It is still a problem. We're working with the speaker, we're working with the mayor, but we're going to close down city playgrounds and leave the open spaces available. So use the open space in a park, walk around, get some sun, great. No density, no basketball games, no close contact, no violation of social distancing, period. That's the rule. Other good news, we are working with all the hospitals in the state to do something they have never done before, which is to act as one, to cooperate, to share supplies, share staff, support one another, shift patients among hospitals, which really has never happened to any great extent. And the hospitals have been very cooperative, and I want to thank them very much. In this war, we must plan forward for the next battle, meaning we have been behind from day one. This virus has been ahead of us from day one. You don't win a war that way. The next battle is the apex. The next battle is on the top of the mountain. You see that curve? You see a curve? I see a mountain. The next battle will happen at the top of that mountain. That's where it is going to be joined. And that's where the enemy either overwhelms our healthcare system, or we are able to handle the onslaught of the enemy at the top of that mountain. And that's what we're planning for every day. But I want to offer you a different perspective that I'm starting to think about, and I think we all should start to think about. as a society, beyond this immediate situation, we should start looking forward to understand how this experience is going to change us, or how it should change us, because this is going to be transformative. It is going to be transformative on a personal basis, on a social basis, on a systems basis. We're never going to be the same again. We're not going to forget what happened here. The fear that we have, the anxiety that we have, that's not just going to go away. When do we get back to normal? I don't think we get back to normal. I think we get back, or we get to a new normal, right? Like with so many facets of society right now. So we will be at a different place. Our challenge is to make sure that transformation and that change is positive and not negative. Let's make sure we're taking the positive lesson and not the negative lesson. You could get wary of intimacy and contact and density, social distancing. Don't go near anyone. A terrible thing to live with as a human being. What a cruel torture. Isolate yourself from other people. Be afraid of hugging someone. Just think how emotionally and personally repugnant that concept is, right? We crave human connection. And now we're being told that could be dangerous. You can't kiss, you can't hug, you can't hold hands. So how we come out of this and making sure that it's positive and not negative. How do we learn from this, and how do we grow from this, right? Society life, you will get knocked on your rear end. You will deal with pain, you will deal with death, you will deal with setback, you will deal with suffering. The question is, how do you get up? Well, first, do you get up? And second, if you get up, how do you get up? Do you get up smarter? Do you get up wiser? Or do you get up bitter? And do you get up angry? And do you get up fearful? We are in control of that. And we have to start to think about that. And we also have to be smarter from what we went through. How do you make the economy more resilient? What happens when something like this happens again? And something like this will happen again. Oh no, this is a once in a lifetime, never again. Something like this will happen again. We're seeing it in the environment, we're seeing it with floods, we're seeing it with hurricanes. Something like this will happen again. You can't just turn off the economy like a light switch. How do governments work together? You can't figure it out on the fly, what the federal government does, what the state government does, what the local governments do. Figure it out before. Learn the lessons from this. Telemedicine and teleeducation. We had to close the schools. Well, why weren't we ready with a teleeducation system? Why weren't we better at telemedicine? Why didn't we have that capacity rather than having people wait on all these lines to come in to get the same basic diagnosis and the same basic advice? Why don't we have medical supplies made in this country? Why are we shopping in China for basic medical supplies? Why don't we gear our medical research to these types of threats and challenges which we know are on the horizon? We know these viruses are changing. We know that they mutate. Why don't we get ahead of it? You still have to run society. Let's talk about first responder capacity. We now have first responders who are getting sick, and the workforce has dropped. That was inevitable, right? That was going to happen. What's the backup to that situation? And let's talk about societal stability and engagement at times of crisis. You can't just tell everyone, go home and lock your doors and sit on your couch and order takeout for the foreseeable future. It's not who we are. It's not even a mental health issue. It's just a personal health issue. It's how we relate to one another. We're not built to be isolated for long periods of time and not have human contact. So how do we deal with that? And these are the types of questions that we have to start to think through. But not today. That is the next challenge, I believe. And that is what we're going to have to think about soon. But for now, one crisis at a time, as they say. And we are planning to handle with the current crisis, preparing for the battle on the Mount, which is what we are doing every day. And that's what we are doing. And not only are we doing it, but we have to succeed at it, you know? Government process is very good at saying, well, we're trying, we're working on this, we're doing our best, we're doing our best. Winston Churchill, it is no use saying we are doing our best. You have got to succeed in doing what is necessary. Tad harsh goes with that expression, which I think you could say tad harsh, handsome, but a tad harsh. But it's true. And that's what I say to my team every day. This is beyond best efforts. This is beyond I'm working very hard. We have to get this done. We have to succeed. We find a way. We have to make it happen because too much is at stake. Last point on a personal note, my brother Christopher, as I told you yesterday, tested positive for the coronavirus. He's at home. He's doing fine enough. He has a fever. He has chills, symptoms of basically a very bad flu. But I think this is illustrative in a number of ways. First of all, anyone can get this disease. Relatively young people, strong people, people who take a lot of vitamin pills, people who go to the gym a lot. Anyone can get this disease. There is no superhero who is immune from this disease. That goes for a New Yorker, as well as a Texan, as well as a Californian. Anyone can get it. No one can be protected from it. I couldn't protect my own brother. With all he knows and as smart as he is, he couldn't protect himself. So anyone can get it, and everyone has to be protected. I understand the data. I understand 80% self-resolve, 20% go in the hospitals. Christopher is not in the category that is problematic. By all the data, should have it. He'll have it for a period of time. And he will then resolve. If he has bad symptoms, he'll go into the hospital. He'll be treated, and he'll be released. That's what all the numbers say. Even though that's what all the numbers say, when he told me he had the coronavirus, it scared me. It frightened me. Why? Because we still don't know. We still don't know. And even if there's just a 1%, 2% chance, it's frightening. It is frightening. It frightened me. And I deal with all sorts of, and I've seen all sorts of things. And it frightened me. Why? Because we're talking about my brother. We're talking about my little brother. This is my best friend. Talk to him several times a day. Basically, spend my whole life with him. And it is frightening on a fundamental level. And it's frightening because there's nothing I can do, and I'm out of control, and there's nobody who can tell me, and Dr. Zucker can't tell me anything, and Tony Fauci can't tell me anything, because nobody really knows. And this situation is the same situation for everyone. For everyone. So yes, I'm frightened for my brother. I'm worried about my brother, as everyone is worried about everyone in their family and everybody they love. I take solace in the numbers and the facts, because you can't divorce yourself from the facts. Otherwise, you go to a place of irrationality. But we're emotional beings. And as emotional being, it is frightening, and it is unknown, and it is threatening, and it is scary, and people are dying. He's going to be okay. I believe that. He's in his basement. I sent him over a book that could be helpful, Beginner's Guide to Striped Bass Fishing. He picks up some tips from that. But I also want to say to him, because I want him to know, he found out yesterday morning that he had coronavirus. He did his show last night. He did a show last night from his basement. What a gutsy, courageous thing to do. And we talked about it. And in some ways, this can be very instructive, I think, to many people. Because everybody wants to know, well, what happens if you get coronavirus? All right, he did. And he does this show every night. Maybe some nights he won't be able to do it, but he does this show every night. So what's the positive? Show the country what it means to have coronavirus. And that information, that experience, can be helpful to people. And that's why he did the show last night. Okay, I have coronavirus. But you know what? Here I'm doing my show. I didn't fall over. I didn't collapse. It's not a death sentence. Here I am, I'm doing my show. Kudos to him. My pop would be proud. I love you, little brother. Even though this isn't a flattering picture. I did not pick this picture with your mouth open, but it is suitable in some ways. Any questions, comments?
Governor, policy for posthumous testing of suspected cases.
If you could repeat that, please, because I missed it. Also, let's do any questions on coronavirus. If you want to do questions on budget or anything else, let's do them at the end. But I'm sorry, I didn't hear your question.
What's the state's policy or procedure for posthumous testing of suspected coronavirus cases?
What's the state's policy for posthumous coronavirus testing? I have no idea. Do you know?
This is based on a clinical picture, right? So if someone died as a result of respiratory illnesses, the person would be tested to be sure and try to figure out what happened to them, because there are contacts that person has been exposed to.
So the death toll includes people that tested positive for coronavirus, or also people who had coronavirus-like symptoms?
So when we know those who have died, and if they're tested at the time of an autopsy, those are included in the deaths.
Governor, can you confirm that there were some patients who were moved from New York City to Albany Medical Center, and I believe also Ellis Hospital as well last night?
Were there patients who were moved, coronavirus patients moved from New York City to Albany Med? Yes. And we've talked about, this is one state, this is one family of New York, this is one family of the United States of America, by the way. We support one another in two ways. Staff from upstate hospitals will be going to downstate hospitals, because one of the real critical situations are staff shortages and staff exhaustion. So upstate staff will come help the downstate hospitals, and downstate hospitals who are at overcapacity can transfer patients to upstate.
Is it safe to move COVID patients who are being
It depends on the patient. But if they're in a place where the hospital can't treat them, then it's better to move them and be in a hospital setting where they can get treated.
So if we're doing this now, does it mean that the downstate hospitals are full? I know that the DOH has data on beds, including ICU beds. Can you make that available? And also, if you said 110,000 beds for COVID, what is the total capacity? Is it still 140,000?
About 140. 110 for COVID would suggest you have 30,000 non-COVID patients. We tried to bring down the patient count by mandating no elective surgery that was non-critical. So people are not going into the hospital right now to have a hip replacement unless they really need it. They're not going in for any type of elective surgery. So it brought the number of patients down so we could get more COVID patients in. The transfer from New York City, the New York City Hospital to Albany Medical was more of a one-off situation, which had been individually arranged. We are now, Department of Health is now coordinating all transfers. And you're right, the first step is transfers within the system. So downstate New York, you have the health and H&H system, transfer among the 11 H&H hospitals to balance load, balance capacity, and transfer among the private hospitals to balance load, then transfer among those two systems, and then worst case scenario, transfer upstate.
So how much capacity is left between H&H and the private hospitals? And I guess Long Island and Westchester too.
Yeah, they are not at capacity now. Depends on how fast that curve goes up. We monitor it on a daily basis, and that's the $64,000 question, Jimmy, is when you get to the apex, you will be over capacity. Any of those, by the way, say you are over capacity. You're over 100% by any model at the apex.
Who determines, Governor, and what is the criteria for moving patients from New York City into upstate hospitals? Do they have local connections, or is that just a medical decision?
It's going to be right.
A terrible, terrible virus.
The transfer that happened was basically
that is spreading around the world at an alarming rate, infecting people from all walks of life, overwhelming hospitals, killing thousands of people. And if we're going to beat this enemy, we need to remember that this virus doesn't travel on its own. It's people that help spread it. So when we stop moving, when we limit contact with one another, the deadly reach of this virus slows down. This morning, our Chief Medical Officer told all municipalities in Ontario to enforce self-isolation for people who have tested positive for COVID-19. Anyone suspected of having the virus and anyone in close contact with them. We have shown so far that we are fully prepared to take every action necessary to slow the spread of this virus, protect Ontarians, and we will not hesitate to take further action. My friends, the hard truth is, right now, today, there's very little separating what we will face here in Ontario from the devastation we've seen in Italy and in Spain. Thousands of lives are at stake. And the action we take today, what we do as a government and as a people, today will determine what we face tomorrow. And these next 2 weeks will be absolutely critical because we know a surge is coming. And it's up to each of us. It's up to every person in Ontario when that surge happens. And every week, every day, hour, we can push back the surge of this deadly virus. Is it a week, another day, another hour that we have to prepare? More time to get desperately needed equipment and supplies. And I've said from the beginning of this that we can't count on traditional supply chains. We can't count on global supply chains for this critical equipment. We need to mobilize Ontario's manufacturing might, because there's nothing we can't make here in Ontario. My friends, there is hope, because in these dark days, the Ontario spirit is shining stronger than ever. A week and a half ago, we launched the Ontario Together portal, and we put a call to all Ontario businesses. We asked them to join the fight against COVID-19, and the response was incredible. We have an army of 14.5 million people all across this great province, hundreds of thousands of innovators and entrepreneurs who have the ability to make the tools we need to fight the virus. Innovators like Spartan Bioscience in Ottawa, who are making portable test kits that you can take anywhere and see test results within an hour. Entrepreneurs like Virox Technologies in Oakville, who created a disinfectant that kills the virus within 30 seconds on any surface. Pioneers like Thornhill Medical, who are making a portable ventilator, and they're doing a great job. Woodbridge, an auto parts manufacturer, is currently testing an N95 equivalent mask with Health Canada. And if they get approval, they'll be able to produce millions of these masks here in Ontario. When you're fighting a deadly virus, these are the people you want in your corner. And today, we're giving Ontario businesses some more ammunition to beat COVID-19 and back up our frontline healthcare workers. The next steps in our plan to mobilize Ontario's manufacturing might is $50 million in a new Ontario Together fund. This fund will help factories retool their production line to make the items we need, like face masks, gloves, swabs, ventilators, and lab testing equipment. We've signed a deal, we've placed an unprecedented order for 10,000 ventilators with O2 Medical Technologies. And the world-class manufacturers like Martin Rea, Magna, and Linamar. That's 10,000 ventilators made right here in Ontario for our hospitals that will save lives. My friends, it's a game changer, and we will keep going. I want our frontline healthcare workers to know that we have your back. Ontario's manufacturing machine has your back. 14.5 million people have your back. And my goal, what I want more than anything right now, is for Ontario to be in a position to support all of Canada. I want Ontario to be the manufacturing engine for all of Canada. We have a lot of work to do, and if we're going to get there, but I truly believe we will. We will get there. I believe we will make what we need right here in Ontario. And then we're going to focus our industrial powerhouse on fighting the virus right across our great nation. So if you can make these life-saving items, if you can retool your business, your province needs you now, and your country needs you now. We have a long and difficult road ahead of us. We have some dark days ahead, but with today's announcement, we're going to ensure that we come out of this stronger and more united than ever. And together, we will beat COVID-19, because this is what Canada is all about. This is what Canadians are all about. Thank you, and God bless the people of Ontario. Now I'll turn things over to Minister Fedeli.
Thank you, Premier. The situation with COVID-19 is changing day by day. In these unprecedented times, we really do need all hands on deck. And the grit, the compassion, the ingenuity, and the strength of all Ontarians has been nothing short of inspiring. We live in unprecedented times, and we can all be proud of how businesses in Ontario have stepped up for their workers, for their communities, and for the province. From day one, businesses large and small have been calling, emailing, and texting offering their services to help us in the fight against COVID-19. Spirits distilleries all across the province are stepping up to the plate and manufacturing hand sanitizers. Inksmith, a company who specializes in education technology, is now using their 3D printers to print face shields for our frontline workers. They're aptly calling them the Canadian Shields. They are also spreading the word across the province to other 3D printer owners to assist in the production of the headbands to attach to these shields. And as the Premier just announced, our government has placed an order with O2 Medical Technologies to produce 10,000 ventilator units by working with our advanced manufacturing sector. These incredible achievements are just a small sample of the kind of work underway right across Ontario. And now, more than ever, we companies like these, from manufacturing specialists to the technology entrepreneurs, work with us. Our job as government is to make it easy as possible for all of you. You have already heard about the Ontario Together website we launched a week ago Saturday. The response has been incredible. We have seen so many innovative proposals from organizations representing every facet of the Ontario economy. And now, to help businesses with successful proposals pivot quickly to manufacturing those critical supplies and equipment that we need, you heard the Premier, we are launching the Ontario Together Fund. We are providing one-time funding of $50 million this year for companies joining us in the fight against COVID-19. This will be available to companies and organizations across the entire province. It's designed to provide immediate resources to these companies so they can begin the work of retooling or building capacity quickly and efficiently. And we will be funding the most viable, innovative proposals that provide the greatest benefit to the people of Ontario the fastest. If you or your business has an idea, supplies, or the ability to innovate a solution to the COVID-19, please log on to ontario.ca/Ontario Together and submit your proposal. We will leave no stone unturned as we join together with Ontario's greatest workers and business leaders to fight the spread of COVID-19. As the Premier has said, we are all on the same team, Team Ontario, Team Canada, and the teamwork is going to be what gets us through these dark days ahead. It's teamwork that will ensure our healthcare system and our frontline workers, such as police officers, correctional officers, and social workers, are equipped with what they need to fight against COVID-19. It's teamwork that will make sure we all maintain social distancing and take the proper precautions so we can protect the health and well-being of everyone in Ontario. And it's teamwork that will help us build a stronger, even more prosperous province. Greatest place in the world, the greatest people in the world, as we work together to combat this pandemic. Thank you.
Okay, we'll go to the phone line. Questions. First question.
First question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Fergie.
Rob, your line is open. Please go ahead.
Hello, Premier.
Hi, Rob.
Just wondering, you talked about the surge is coming. I'm assuming that means that you have a projection. So what and when can we expect from this surge when you're referencing Italy and Spain?
Well, we can't give you an exact time frame through our Chief Medical Officer of Health and our COVID-19 command table. We know it's coming over the next few weeks. Can I say it's tomorrow or the next day? I can't give you an exact time, but I know we're going to face it over the next few weeks, and we just want to prepare people to continue practicing social distancing, making sure they self-isolate, making sure people, as the order came out today from our Chief Medical Officer, if you if you do have COVID-19, self-isolate for 2 weeks, and the people around you have to self-isolate as well. You can't have a loved one in the house and you have COVID-19 and the loved one goes and goes out. That can't happen. That will just increase the spread. So over the next weeks, we're going to face some turbulent waters. It's a race. It's a race against this virus, and versus making sure we get the ventilators, get the PPEs that we need for the frontline healthcare workers. So we just want to make sure people understand how serious this is, and we're out here every single day saying make sure we practice social distancing.
Okay, follow-up. I keep hearing from on email and text from nurses. They hear a lot of talk about getting new supplies, but they don't hear a lot of talk about delivery. So when are some meaningful deliveries coming for N95 masks, for surgical masks, for gowns, for more ventilators, for more gloves, kinds of things?
Yeah, Rob, very good point. I hear the same concerns. Deliveries happen every single day. Shipments are going across the province. Shipments are coming in. I know there's a big supply coming in from the federal government the next day or so. So as soon as we get our hands on those, we won't waste a second. We'll make sure they get distributed to the over 140 hospitals and long-term care homes, along with your homes. We just have to make sure that we expedite this immediately, and that's exactly what our plan is.
Next question.
The next question comes from Cynthia Mulligan of City News. Please go ahead.
Hello, Premier.
Hi, Cynthia.
Today, the Toronto Medical Officer of Health said that they have modeling projections on what they think the surge will look like here, what those numbers will be. She wouldn't give those numbers. I'm asking if you will. We heard what they are in the U.S. You have mentioned New York, so did Tory, so did Dr. Davila. Is that what we're in store for? And can you give us the numbers on what people are fearing?
Well, Cynthia, I'm going to hand this over to the Deputy Premier and Minister of Health, Minister Elliott. Thank you.
Well, thank you, Cynthia. There are a number of different models that are out there that are being used by different groups. But I think what all the models indicate is that the next several weeks are going to be really critical for if we are going to be able to flatten this curve and not have a tremendous increase in the number of COVID-19 cases and unfortunately deaths. So I think all of the models indicate how important it is to maintain that physical distancing, to make sure, as Dr. Williams indicated today, to the local medical officers of health, to ensure people who have been diagnosed with COVID-19 are staying at home if they're able to be at home and not in hospital, and that the members of their family do the same. That is critically important for us to flatten the curve and to prevent our health capacities from being overwhelmed in our hospitals. So I think that all modeling suggests that, and that's what we're urging all Ontarians to please do.
Okay, my follow-up is for the Premier, please. Premier Ford, Dr. Davila today said that she is doing everything she can in her powers. You have even more power to shut things down while we're waiting for this surge. One of the things that she asked for is for the province to close more businesses that are at this point deemed essential. Construction is a big one. Why aren't you shutting down construction and more businesses to try and flatten this curve?
Well, that's being reviewed absolutely every day. I've said to you, we're going to be adjusting that list. You'll hear that in the next day or so. Let's talk about the construction out there. We had 300 inspections over the last few days. We've shut down 3 sites. We've sent out 160 orders to comply, and I won't hesitate to shut down any single site. We also have to keep in mind, once you hit one trigger, it affects 10 other triggers, and I'll explain it. There's thousands and thousands of people across this province waiting to get into their home, and I think I mentioned it the other day. I got a call from a couple saying that they have no place to live because they sold their house. They didn't realize this was going to happen. Their new house isn't ready. It's weeks away, and but again, if the sites aren't safe, We have hundreds of inspectors right across this province going into every site possible, and if it's not safe, they're going to be shut down. It's as simple as that. But we will be reviewing the list. We're going to be adjusting the list, and we'll do everything we can to reduce that list. The supply chain is long when it comes to making sure we have food in the retail grocery chains. It's absolutely critical we keep that supply chain going, but we're going through it as we speak over the last couple of days to adjust the list there.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi there.
Hi. Hi, Laura.
Premier, I'm wondering on the numbers in long-term care facilities. Yesterday, the Associate Medical Officer of Health was asked about how many outbreaks there are in long-term care homes and how many deaths there are. She gave numbers that are much, much lower than have been determined by reporters. And she also said that her numbers are not up to date. How is it that the province's top health officials don't seem to have an accurate understanding of what is happening in long-term care facilities across this province?
I'll pass that over to the Minister of Health. Thank you.
Well, we are getting that information on a daily basis. It's perhaps maybe because the deputy wasn't informed at that time of the exact number, but we do get it on a regular basis. We are very concerned about outbreaks in long-term care homes. That's a very, very vulnerable group of people that we need to protect, absolutely. There's more that we can do. We've got very strict requirements now with respect to no visitors except for palliative purposes, that the staff are on a daily basis, and that the residents are still being checked with some of our testing that happens for people who seem well. So this is a group of people that often have other physical problems, who are very susceptible to catching COVID-19. We want to make sure that we can build that iron ring around both the long-term care homes, the retirement homes, and other homes and congregate group settings that house people that are particularly vulnerable, including people with intellectual disabilities. So it's a high target population for us to protect.
But shouldn't health officials have up-to-date information on this? And also, could you outline specific measures that are happening at Pinecrest right now? Can you comment on increased testing? How are people being isolated when there appears to be no room to move residents around? And also, can you address staff shortages? How are you going to increase the number of workers coming in when some workers are falling ill? And will you be increasing wages for personal support workers?
Well, first, just on the issue of the information itself, I can tell you that the Dr. Williams, Dr. Yaffe, and others are in virtually all-day briefings these days, trying to present the information that they have to the public and to answer any questions. It may be that in between, because this is a very fluid situation, that there might have been a change in the numbers, but certainly the information is available on a daily basis. Secondly, with respect to the movement and placement of people in long-term care who may need to be relocated, we are looking at other spaces. We're looking at hotel spaces, any other spaces that may be both accessible as well as appropriate for them, to make sure that they are safely cared for. And in terms of increasing wages at this point, that is not something we're looking at. We're finding that our frontline healthcare workers are doing a wonderful job. They are really heroes in this whole system, and that's why we're facing the demand for, as we should be, for personal protective equipment, and that is what is occupying a good part of the Premier's time and my time these days, because we want to make sure, above all else, that our frontline healthcare workers are protected for themselves, for their families, of course, and also for their patients.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi, just a question, ventilators. So when are we expecting the 10,000 to be ready? I imagine they'd be ready in smaller batches and distributed right away, but what time frame are we looking at? And if the next 2 weeks are full, are they going to arrive in time?
Well, that's the race we're facing. I'm in constant contact with them. Linda, the CEO of Linamar, which is doing an incredible job, just a real true champion, is leading the charge. Putting their expertise behind it, their engineering expertise behind it, hopefully over the next 3 or 4 weeks. That's the challenge right now we're facing. It's a race against a time with this surge that we're going to be seeing and getting these ventilators online. They're going to be coming off the production line, and they're going to go right into service immediately. But we aren't just standing still. We're working with companies like Thornhill. We're working with also manufacturing ventilators. We're working with the federal government. We're reaching out to companies across the world that have ventilators, and we're buying the 10s and the 5s and the 20s. So we're reaching out to everyone, and we're just going to continue moving around the clock as they are the O2 company that are working around the clock to make sure we expedite this as soon as possible. We're doing something that's really amazing. We put the call out about a week and a half, 2 weeks ago, and they're putting together a line that would typically take even upwards to a year. They're doing it in weeks, sourcing the parts, getting the line together. And there's no better person that I have more faith in than Linda, the CEO over at Linamar, leading the charge.
And to the health minister, have you or the command table, have you actually seen any modeling that shows us the number of deaths Ontario could experience even if we flatten the curve? Has that number actually been charted? And will you share that specific number with Ontarians who obviously are watching our American counterparts get that number and jolting them into reality? Other people would like to know if Ontario has that specific projected death rate if we flatten the curve. Have you seen that number, and will you share that number?
Well, I can tell you that there are a number of different models that have been presented to us, and that the point of the model is really to help give you guidance on how to deal with the situation, which we are doing, and we are trying to flatten that curve every day. We can't predict right now what's going to happen because the model is just that, a model. We are dealing with what's happening in the real world. We have seen an increase yesterday over today that's quite significant. However, I think it's also important to note that we're still working on the backlog of cases that we had, and it was about 10,000 about a week ago. Right now it's about 3,100. So the cases that are currently being diagnosed are really historic cases looking back at what's happened over the last week to 10 days. What's going to be most important is what we're going to see when the backlog is cleared over the next day or so. We will then be dealing with current information, and that is what's going to tell us where we are in terms of flattening the curve, and the work that has been done by our frontline providers, who are doing an amazing job, but also by the 14.5 million people of Ontario. And that's why we continue to ask you to please, please stay at home as much as possible. Please go into self-isolation as you've been required by law now to do when you return to Canada. And if you've been diagnosed as a positive case and you're at home and not in hospital, you must stay there for 14 days, as must your family if they've been exposed to you. So all of that is what's going to really make the difference at the end of the day for all of us.
Next question.
Next question comes from Christina Tenaglia from CP24. Please go ahead.
Thank you so much. These two questions for Premier Ford. Premier, I know you had just mentioned, as per Cynthia's question earlier, that you're reviewing essential services or workplaces and businesses list, and there's more to come in the next few days. I'm wondering if you anticipate announcing changes to that list before the April 13th date, since there's been an extension to that list up until April the 13th.
Well, we're reviewing it every single day, Christina, and we're adjusting the list every day, and we'll be rolling it out. Minister Fedeli is heading that up. Minister of Economic Development, Job Creation. He understands this better than any of us, but he's taking it seriously. He has a whole team, and make sure that we make those adjustments.
My next question, because Education Minister Steve Lecce is not present, is for you, Premier. We have heard from a number of teachers after your announcement yesterday. One grade 8 teacher that contacted us says that the government's model for online learning is going to fail. He says it's an invitation for children to cheat and not get a meaningful result. And he says teachers want the time to be spent reviewing things the students have already learned and assessing why so many fell behind on their EQAO test. Wondering what your response is to that.
Well, I know the minister's #1 goal is to make sure that our students, our children, are continuing to learn on a daily basis, no matter if it's the TVO model that's out there or other models. We want to make sure that they continue to learn, and he's working hard to make sure we have a system that he feels comfortable, teachers feel comfortable, the boards feel comfortable. I can tell you with Minister Lecce, he just doesn't wake up in the morning and make a decision. He consults with all the stakeholders right across the board, and I'm sure he's listening today, and I'm sure he'll give you a call personally to follow up on that question. He's taking the best advice from all the professionals in the education system to make that decision. I know he didn't make that himself. So he did get advice from teachers, school boards, school trustees, and other stakeholders.
Next question.
Next question comes from Mike Crawley at CBC News. Please go ahead.
Hi, Premier. Question for Minister Elliott. The trend over the past few days in the ICUs is showing a pretty sharp increase in the number of confirmed patients, confirmed COVID patients in the intensive cares. How concerned are you that this trend is going to continue and that the ICUs in this province are going to be overwhelmed by demand?
Well, it is something that we're keeping a very close eye on. Of course, Mike, there are 145 people right now in ICU, 98 of whom are on ventilators. It's something that we are concentrating to make sure that we can expand our resources to ensure that as we see an increase, we're going to be able to care for those patients. But as I indicated before, that the increase in cases that we've seen over the last few days are really respect the situation that was happening a week to 10 days ago, because we are still clearing the backlog. What's going to be really telling to all of us is going to be once that backlog is cleared in the next day or so, then seeing the number of new cases that are coming in. We are certainly prepared for an increase. We are planning that capacity both in terms of the equipment, the hospital space, and health human resource. We have had about 10,000 people already who have volunteered to come serve. That is from people who are retired nurses, for example. We've also got medical students who are helping us on the front line with the following up with the with the public health units out in communities, and we are monitoring all of that very closely. So the people of Ontario are but we are certainly making sure that our hospitals have the equipment that they need, that they have the ventilators that they need, and the acute intensive care spaces. We have the 10,000 ventilators that are coming in, as the Premier has indicated, but we've also received a loan of several hundred more ventilators from cosmetic surgeons, dental surgeons, and so on, who are donating or letting us use their respirators in the short term. So we are receiving these pieces of equipment in on a daily basis, and we're following it very closely.
My follow-up to the Premier, if possible. Premier, off the top, you talked about how important it is that the local health units use their powers to enforce that people who have confirmed cases of COVID-19 are in fact isolating. Do you have some evidence that there's actually people with confirmed cases out walking around in the public? And if that's the case, why didn't you order a crackdown on this sooner?
Well, again, we're taking our advice off our Chief Medical Officer on that issue. We're also concerned about quite a bit, Mike, is people that are living with someone or in close contact with someone with COVID-19 to make sure that they follow the exact same rules as applies to people with COVID-19. And actually, I'll pass this one over to Minister Elliott, and she'll give you more information on that.
Well, this is something that we've only become more recently aware of as a concern, but Dr. Williams has issued a directive today, issuing his strong recommendation that the local medical officers of health use their powers under Section 22 of the Health Protection and Promotion Act, require that people who have been diagnosed with COVID-19 maintain that status and stay in self-isolation. This is going to be followed up on by the local medical officers of health, and there are significant fines for people to not do that. But I think the most important thing is that they will be followed up with their local medical officers of health to make sure that they are continuing that self-isolation.
Next question.
The next question comes from Haley Cooper from News Talk 1010. Please go ahead.
Good afternoon, Premier. We've had Rob and Cynthia and Colin now ask about modeling and projections, and I was going to ask myself, and we still haven't been given any numbers. So why does it appear the government is hesitating in giving those numbers? You know, people know that this is a fluid situation, but they
Hello
also...
everyone from Geneva. We do apologize for this delay. Thank you very much for watching us on many WHO social media platforms. Tonight we are for the regular press briefing on COVID-19 with Dr. Maria Van Kerkhove and Dr. Mike Ryan. Before I give the floor to Dr. Ryan, just to remind you that we will have audio file from this press briefing immediately available with a couple of links to news that have been issued in different WHO offices, as well as advisories for media briefings that will be held by our regional offices. So you will get that after the briefing. Now I give the floor to Dr. Tedros.
Thank you. Thank you, Tariq, and I would like to join Tariq in apologizing for the delay. Good morning, good afternoon, and good evening, wherever you are. As we enter the fourth month since the start of the COVID-19 pandemic, I'm deeply concerned about the rapid escalation and global spread of infection. Over the past 5 weeks, we have witnessed a near exponential growth in the number of new cases, reaching almost every country, territory, and area. The number of deaths has more than doubled in the past week. In the next few days, we will reach 1 million confirmed cases and 50,000 deaths. While relatively lower numbers of confirmed cases have been reported from Africa and from Central and South America, we realized that COVID-19 could have serious social, economic, and political consequences for these regions. It's critical that we ensure these countries are well equipped to detect, test, isolate, and treat cases and identify contacts. I'm encouraged to see that this is occurring in many countries despite limited resources. Many countries are asking people to stay at home and shutting down population movement can help to limit transmission of the virus, but can have unintended consequences for the poorest and most vulnerable people. I have called on governments to put in place social welfare measures to ensure vulnerable people have food and other life essentials during this crisis. In India, for example, Prime Minister Modi has announced a $24 billion package, including free food rations for 800 million disadvantaged people, cash transfers to 204 million poor women, and free cooking of gas for 80 million households for the next 3 months. Many developing countries will struggle to implement social welfare programs of this nature. For those countries, debt relief is essential to enable them to take care of their people and avoid economic collapse. This is a call from the WHO, the World Bank, and IMF, debt relief for developing countries. 3 months ago, we knew almost nothing about this virus. Collectively, we have learned an enormous amount, and every day we learn more. WHO is committed to serving all people everywhere with the best evidence to protect their health. WHO develops guidance based on the totality of evidence collected from around the world. Every day, our staff talk to thousands of experts around the world to collect and distill the evidence and experience. We constantly review and update our guidance as we learn more, and we're working to adapt it for specific contexts. For example, we recommend hand washing and physical distancing, but we also recognize this can be a practical challenge for those who lack access to clean water or who live in cramped conditions. Together with UNICEF and the International Federation of the Red Cross, we have published new guidance for improving access to hand washing. The guidance recommends that countries set up hand washing stations at the entrance to public buildings, offices, bus stops, and train stations, and many countries are doing it. We're also working hard with researchers all over the world to generate the evidence about which medicines are most effective for treating COVID-19. There has been an extraordinary response to our call for countries to join the Solidarity Trial, which is comparing 4 drugs and drug combinations. So far, 74 countries have either joined the trial or are in the process of joining. As of this morning, more than 200 patients had been randomly assigned to one of the study arms. Each new patient who joins the trial gets us one step closer to knowing which drugs work. We're also continuing to study the evidence about the use of masks. WHO's priority is that frontline health workers are able to access essential personal protective equipment, including medical masks and respirators. That's why we're continuing to work with governments and manufacturers to step up the production and distribution of personal protective equipment, including masks. There is an ongoing debate about the use of masks at the community level. WHO recommends the use of medical masks for people who are sick and those caring for them. However, in these circumstances, masks are only effective when combined with other protective measures. WHO continues to gather all available evidence and continues to evaluate the potential use of masks more broadly to control COVID-19 transmission at the community level. This is still a very new virus, and we're learning all the time. As the pandemic evolves, so does the evidence, and so does our eyes. But what doesn't change is WHO's commitment to protecting the health of all people based on the best science without fear or favor. I thank you.
Thank you very much, Dr. Tedros. We will now open the floor for questions. I will just remind you that we will try to keep one question per person, so we try to get as many as possible. As we were late, we will not be able to stay very long. So let's start first from Italy. Giulio from Rai. Dulio, can you hear us? Can we try one more time? For Italy, Dulio, Gianmaria. Okay, we don't have a Dulio online. We may try to come back to him. Let's try to Jamil from Brazilian media. Jamil, can you hear us?
Yes, can you hear me, Tarek?
Yes, Jamil, please go ahead.
Perfect. Dr. Tedros, thank you for taking my question. Yesterday, especially, President Bolsonaro has misused your words to justify his policy in Brazil. My question to you, what is your message to the Brazilian people and to the Brazilian leadership? Thank you.
I think the message that WHO is giving to all countries is that we need a comprehensive strategy to respond to this disease. We need, in addition to any measures around lockdown, we need to put in place a comprehensive strategy based on surveillance, on public health intervention, case detection, testing, isolation, quarantine, and strengthening our health systems to absorb the blow, and the blow that many health systems around the world have had to bear over the last number of weeks, which has been a tragedy for all those caught up in it. It's really, really important that all countries take this seriously, get ready, prepare their health system, strengthen their public health architecture, engage their communities, educate communities, and bring communities on board, and leave no one behind. And I think this is advice we're giving to all countries, not just Brazil.
Thank you very much, Dr. Ran. Try one more time with Dulio from Italy. He was on mute. Apparently, Dulio, are you available now? Dulio, Gianmaria, can you unmute yourself? Well, apparently it is not working, so we will move on. We'll move to Stephanie from Reuters. Stephanie, can you hear me?
Thank you. Yes, can you hear me?
Yes, please, go ahead.
Thank you very much. Perhaps a question, a data question, perhaps for Mike. China has now disclosed that it's, the number of asymptomatic cases, and that they're not counting it in their statistics that they are reporting as confirmed cases. I wondered if you could comment for us, please, and put it in some context. Today, for example, they said there were about 130 asymptomatic cases, which they're excluding from their figures. Can you help us understand that? The South China Post has said that, according to classified data, there's 43,000 cases. So how does that tally as a ratio with, 80,000 confirmed cases? And are you getting an accurate reading of the situation, giving you an accurate picture? Thank you.
Hi, Stephanie. Great to hear your voice again. I'm going to pass to Marie on this because Marie's been tracking this one.
Thanks, Stephanie. So with regards to the reporting of cases, our case definitions include laboratory confirmed cases regardless of the development of symptoms, because we know that there are individuals who are followed up through contact tracing, and they're identified very quickly. And some of those individuals who are identified have not yet developed symptoms. And so it's important for us to capture those individuals as part of case detection, as part of surveillance. Because from data that we've seen from China in particular, we know that individuals who are identified who are listed as asymptomatic, about 75% of those actually go on to develop symptoms. So when we look at our language and we look at what proportion of the reported cases are asymptomatic, it's important to classify those as no symptoms and PCR positive, and then do not go on to develop symptoms. Those individuals who are identified as asymptomatic at the time of reporting and go on to develop symptoms, so 75% of those, are actually pre-symptomatic. They're in that pre-symptomatic phase. And then, of course, most of the people that are identified are symptomatic. And we know that through transmission, the transmission of this virus is driven by people who are asymptomatic. But it is important for us to capture that full spectrum of illness, that full spectrum of detection through surveillance. So again, our case definition includes laboratory confirmed cases regardless of the development of symptoms.
Thank you very much. We will go to Michael, contributor to CNN. Michael, can you hear us?
I can hear you. Can you hear me?
Yes, please go ahead.
Okay, thank you for taking my call. I'm dialing in from British Columbia today. In around 3 weeks from now, the holy month of Ramadan will commence. Of course, hundreds of millions of faithful will be taking in this, breaking their fast, eating together, sharing food. There's the tradition, as you know, of Ramadan tents, where large numbers gather. I know, Director, as a former UNICEF spokesperson in that region, it's very important to get unambiguous and clear public health messaging out early if behaviors are to be changed in any way. What would be your message right now to religious leaders, to governments in the region in order to prevent a further outbreak during this very special time of the year? Thank you.
Yeah, thank you. Thank you much. In this response and in the fight against this pandemic, the role of political leaders is central. The role of business leaders is very, very important and central too. And the role of religious leaders and community leaders is very, very important. And we're reaching out to government leaders, political leaders, business leaders, religious leaders, and community leaders, and other influencers. It's through those leaders that we can reach out to all communities to take part in the fight. Then having said this, with regard to Ramadan, as you have been following, countries in the Middle East have been doing everything they can to limit the spread of the virus. And we will continue to engage, and I know that we will have an amicable solution on this one too. We're very close and closely working, and our cooperation so far is very, very successful, and we hope that we'll continue in that spirit. By the way, not only something they're doing for their own region, we're getting a lot of financial support from the Middle East and from the Arab League members. And I would like to use this opportunity actually to thank them, not only for taking serious measures in their respective countries, but for their solidarity to support countries who need support. And the recent pledge, as you remember, is from Saudi Arabia, I have said a few days ago, and yesterday from Kuwait, big financial support. And we will keep in touch, we will work with them closely, and I know they will continue to protect their own people, but at the same time support countries and communities who need their support.
Thank you very much, Dr. Tedros. We go to Guatemala now, to Grecia Ortiz, Diario de la Hora. Can you please ask your question?
Thank you so much. Can you hear me?
Yes, please.
Thank you. How do you see the situation for COVID-19 in Central America, and what are your recommendations for the governments?
Thank you very much, Grecia.
I think there's the countries of Central America are sort of at the beginning or the upcycle of the epidemic. There are different capacities in different countries and different risks and different threats. There are lots of vulnerable people, migrants and others who are scattered throughout the sub-region, and there are many other communities who may be left behind as well. So Central America is dealing with the challenge, its own challenges. Certainly the small island nations of the Caribbean equally have different challenges. So each country has a different combination of economic challenge, social challenge, its vulnerable populations, its public health system, its healthcare system, and how all this is put together. And it's really important that each country, and I am glad to report that almost every country in Central and South America now has a national action plan that is being supported by the international community, in many cases by humanitarian partners in the UN system and NGO partners. And some countries do need that external assistance. It's also important that countries in the Americas, in Central America, in the Caribbean, in South America, are coordinating amongst each other to align their strategies and to align their policies, so we don't see massive differentials in action and pushing people from one side to the other. We have people moving throughout the Americas, and we need to be sensitive to those who have least, and we need to be sensitive to those who are most vulnerable. But it is important that Central America, like all sub-regions, scales up its public health response, scales up its community engagement, scales up its health preparedness, and has, as the Director General has said so many times, an all-of-government approach to this. This is serious. This is a deadly virus. People will get through it, countries will get through it, but we must build the architecture of public health, the architecture of our health system, if we're going to get out of an interminable cycle of economically punishing lockdowns and shutdowns. We must get back to be able to control this virus, live with this virus, develop the vaccines that we need to finally eradicate this virus. So, as I said, the message to Central America is very similar to that to the rest of the world.
If I could just add, so we have, within our guidance materials, what we've done is we've, in addition to putting out general guidance around prevention and control and clinical management, we've put out a series of guidance documents relating to the 4 Cs, these no cases, clusters of cases, community transmission, so that there's specific actions associated with what needs to be done with whatever transmission scenario you're in, but also to prepare for other scenarios that you could eventually be in, and get your systems ready, and just activate those systems now. We've seen how this virus behaves in a number of countries, and we need to prepare for that may happen in your country. So there's some practical guidance that we have on our website related to clinical operations and getting your hospitals ready, finding locations where you can treat mild patients versus severe patients, readying your workforce so that you can have people who can identify cases and help with case finding and contact tracing, to help find where you can quarantine your contacts. So there's some practical information line that's there to help you tailor that approach and what Mike said around this comprehensive measures to get yourselves ready and activate those systems now.
Thank you very much. We will try now to connect to Mr. Bujar Vitya from Gazeta Sznet, that's Kosovo-based outlet. Mr. Bujar, can you hear us?
Can you?
Yes, please go ahead.
Thank you. From February 1st until today, over 20,000 people have entered Kosovo from abroad, mainly Italy, Germany, and Switzerland. The first case was confirmed on Monday 9. We are now in the 4th week of the epidemic with 100 cases. In 1,300 people have been tested. What is the best recommendation for Kosovo considering these numbers? Do you recommend more tests? Thanks so much.
Okay. Kosovo is a country that has obviously emerged from very difficult time, has had to rebuild its health service, and to everybody in Kosovo. I spent many months in Kosovo helping to stabilise the health system in the aftermath of the great difficulties there. And I know and deeply the vulnerabilities and the challenges the health system in Kosovo and the people of Kosovo have faced over the years. And the health system in Kosovo is still vulnerable. It has many excellent professionals within it. It's a hugely committed workforce. But we do need to ensure that we have in place good surveillance. Kosovo has had and built an early warning system that's syndromic. It needs to build on that. Kosovo needs to have an active system of detecting cases. We need to have the testing in place, and we need to invest in building the community response and having community-based surveillance and strengthening the healthcare system so that you can deal with the cases. Albania and Kosovo are only across the water from Italy. You are very, very close to some of the most intense epidemics in the world right now, and it is really important that health systems in the Balkans in general, but in Kosovo specifically, need to be rapidly strengthened and be able to cope with this disease as it may accelerate. So again, with my warmest greetings to all my friends in Kosovo.
Thank you very much. We have more questions from the Balkans. We may come back to them later. Let's go now to India. Do we have someone from India today? And that's
Hi, my name is Ankit Kumar. I represent India today.
Yes, Ankit, please go ahead.
Is the World Health Organization been tracking the developments in India? How will you comment on the progress made by India in the first week of lockdown, and how do you assess the results so far? Thank you.
I think it's a little early to assess the results of the lockdown, but I think we need to step back and assess the results of the response in general. Lockdowns and shutdowns are really should just be part of an overall comprehensive strategy. And what we need to be able to do as societies and with the leadership of an all-of-government approach is to be able to implement a consistent policy for a period of time and then see where that takes us and then measure and see what we need to do next. We need to be very careful not to knee-jerk. We need to be very careful not to be changing policies every single day, because people on the front line need certainty in their days. Communities need some certainty. So it's really important that we are very consistent in our communication with communities and our frontline workers about what we do. And we need to give clear messages about what we do for the next week or the next 2 weeks. And we need to then be clear when we're going to evaluate the impact of that period of intervention. And then if we have to change, we change, and we communicate that clearly. And then we do it again for another 2 or 3 weeks. And then we see how that works. And then we gather the information, and then we consult with our frontline workers. And then if we have to adjust or change. This is about adapt, adjust, implement, measure. Do it again, and you just have to keep doing that over and over and over again until you control the disease. I would love to say that there's an easy way to do this. I would love to say that there's a way out of this without that kind of hard work, but there isn't. We have to be comprehensive. We have to measure everything we do. We have to measure at below the national level, and then if we have to use lockdown, if we have to use shutdowns, we do them as part of an overall comprehensive strategy. I would say India, and as the Director General has said in his speech, has made a really huge attempt to limit the impact of the shutdowns on people who are most at risk and people who are most vulnerable in India, and that's a great thing to see. We see increase in testing. We're seeing an increase in surveillance, and we're seeing an investment in the healthcare system to be able to deal with more cases. But it is certainly too early for to determine the impact of the shutdown or lockdown measures on disease transmission at this point.
Thank you, Mike. I mean, the health issues are very important, as Mike said. I would like to add the other side. As you know, this is the first ever coronavirus pandemic in the world, meaning there are many unknowns. And whether we do shutdowns or take other measures, we have to understand that we're in a learning process. We have to constantly learn from our actions and adjust based on what we learn. I would like to again underline, this is the first ever coronavirus pandemic and its behavior is still unknown. And that's why we should always be in a learning mode. The other part is not only the public health measures during shutdown, but it should be the social and economic factors that we should consider. And what India is doing, as I said in my statement, is very, very important. During shutdowns, there will be economic consequences on the country at large, but more important, individuals who live on daily subsistence, who give their labor for their daily bread, could be affected the most. And that's why India is taking measures like the $24 billion package. And not only that, this will cover 800 million individuals as food ration during the difficult times, and cash transfers to 200 million women. And of course, 80 million households will also benefit for the next months from getting free cooking gas. That's the kind of support we said it should be given. So we should not see it from the public health part alone, but see it from the angle of what the consequences of these public health measures will be on the community and try to support our citizens. And this should be seen during these difficult times, during the lockdowns as so-called, and that's how we can get the best impact, but at the same time cooperation from our communities too, because if we understand and try to help them. But there was another important element I mentioned in my presser today, because it's very important, I'll repeat it. Many countries, many developing countries, cannot really support their society, especially during lockdown, especially on those community members who work for their daily breads. And that's why we called on the international community to have a relief to support those countries. But as you also know, that relief processes are actually lengthy. But what we're proposing together with the World Bank and IMF is an expedited process to support countries so their economy will not be getting into crisis and their communities will not be really getting into crisis. This is a time when we need solidarity, not only for public health, but also to address the economic and social challenges that many countries are facing as we speak. I will repeat with what I started. This is a pandemic for the first time caused by a coronavirus and whose behavior is not really known, and we have to stand in unison to fight this unknown and dangerous virus.
Just wanted to supplement with what and Dr. Tedros has said, and one of the things that we are working very hard on is to systematically assess the actions that are being taken by countries. As Dr. Tedros has just said, this is the first pandemic of a coronavirus, and it's important for us to critically look at what countries are doing so that we can assess these and see which actions have worked best and which combination of these have worked best. And there's a lot of factors that go into this that relate to this comprehensive approach that we've been talking about. So, for example, what are the testing strategies that countries are using, and what is the % positive that they're seeing in terms of the numbers of tests that they've done? What is their surveillance strategy? How are countries looking for cases? Are they looking at suspect cases and contacts? Are they trying to identify additional cases through existing respiratory disease surveillance systems like their ILI or their SARI surveillance systems? How are the public measures being applied, and when and where? What movement restrictions are put in place, when and where and for how long? How are our governments and leaders communicating with their populations, with their people? What type of support is being provided to communities? And how are we innovating? And how are we conducting research to learn and feed that back into the response? All of those things need to be done at a national level and at subnational levels to look and see which actions are the most effective. We have evidence from Asia in terms of a number of countries now that have broken this down to subnational levels to look at what has been done where, and what we've been saying about aggressively looking for cases, testing suspect cases, finding contacts, quarantining contacts, isolating patients, and caring for them depending on their severity. Those work. But we also need to continually assess what is being done as this pandemic moves across the globe so that we can build up that evidence base to show what works and to make sure that countries have a tailored approach to their response.
Thank you very much. From India, we will move to Scotland. Anthony from De Gaudi. Anthony, can you hear us?
I can. Can you hear me?
Yes, please go ahead.
Great. So I'm Anthony Newman from the Gaudi newspaper. Because of the pandemic, millions of students around the world have had to put their studies on hold. Could you elaborate on what the WHO and national governments can do to aid students and educational institutions at this very difficult time? Thank you.
Well, first of all, we thank all the medical, nursing, physiotherapy and other educational institutions around the world who've done such a fine job turning out wonderful professionals who can come and help on the front line in so many countries. Clearly, we thank them, those institutions and those individuals who are stepping forward to volunteer, but we also have to be sure that those individuals are protected, that they're doing work that they're well trained and qualified to do, they're well supervised, and that they actually can assist and add to the value of the response. So we have a duty of care to them, duty of care to the patients to ensure that we're given the best possible care, and we're using pre-qualified professionals in any part of the medical system are doing work that they're capable of doing and supervised in doing. With regard, it's also obviously very important that at some point that these students, particularly the ones who are near final exams, have the opportunity to qualify and get into the system. And I'm sure that national medical, nursing and other educational policies are being studied and adapted to see how that can be achieved. And will pass to Maria if she has any further points on this matter. But we will certainly be happy to work with national governments and with national medical, nursing and other educational institutes to see if we can come up with rational policies to guide the completion of education for many, particularly late-stage students in the medicals.
Thank you very much, Dr. Ryan. We will now go to Russia. Anna Redkina from Russia 24. Anna, can you hear us?
Yes, I can hear you. Can you hear me?
Yes, please go ahead.
Yeah. Hi, thank you much for taking my question. Here in Russia, we see a sharp rise in the local wholesale and retail price of ginger. Could you please clarify whether ginger can really help to prevent or treat the new coronavirus, or is it just a myth?
I think we have to be careful from what we would consider to be the traditional remedies that people use for making themselves feel better during a common cold or the flu or any illness. We've all had illnesses, and some of us like to take with honey, some like to take ginger, some of us take special herbal teas. Anything that makes one feel better, anything that provides that reassurance, and anything that you believe can help your health that's dangerous certainly has a positive impact on your health. But it's a different thing to say that something effective in treating the disease. At this moment, there is no therapy that has been proven to be effective in the treatment of COVID-19. We've explained, and the DG has explained actually earlier, about the Solidarity trials and many other trials that are testing many, many different compounds around the world, including the ones that are most promising. So I advise people that if you have your favourite remedy that you use, like honey, like lemon, like ginger, please continue to support yourself through the illness. But please let us avoid making assumptions without evidence that certain things can cure COVID-19. At the moment, there is no proven therapy for COVID-19. Maria?
Thank you very much. That was Russia 24. Now we will go to Karen Wolfson from World Health Alert Crisis. Karen was with us almost every press conference, so we are happy to hear from her now. Karen, please go ahead.
Good afternoon, good morning, and good evening. I'd like to ask how can individuals be persuaded that COVID-19 is a real threat, and what each person does makes a difference. Some people still don't understand that if they fail to follow the physical distancing rules, they could be infecting other people that may lead to deaths further down the line. Or is it the case that some individuals need to be persuaded that what happens in their community as a whole is really important, and that a greater sense of local community needs to be established in order for them to take on physical distancing? That's my question.
So thank you for that question. I think you almost answered your question, in the sense that COVID-19 is a real threat, to everyone on the planet. It's a new virus, which means everyone is susceptible to infection. It is a virus that causes disease in people, which range from some individuals will have mild disease, and a large proportion, 15%, will have severe disease, another 5% will have critical disease, and some people will die. So many individuals who will develop severe disease are older, but we have seen in a number of countries that younger people are dying. I'm looking at data from Italy here, and we have individuals in their 30s who are dying. We have individuals in their 40s, in their 50s who are dying. This is a virus that can be very serious in individuals, and so it's a real threat. It not only has public health implications, but it has very strong social and economic implications. And everyone needs to understand that they have a role to play. Every person has a role to play in this pandemic, and a sense of duty to ensure that they take every precaution that they can to protect themselves from getting infected. And we've listed a number of ways in which can protect themselves through hand hygiene and respiratory etiquette, through physical distancing, by removing opportunities for yourself to get infected. If you can prevent yourself from getting infected, you could prevent onward transmission to someone who may be more vulnerable, who could develop more severe disease and die. That is a responsibility that you have to yourself, to protect your family, and to protect your community and your loved ones. And that is something that everybody needs to understand. Every person on the planet has a role to play here, and they need to feel empowered to be able to do something about that, to protect themselves.
Thank you very much for that. We have a time really for one or two more questions, so we will go to Nigeria now, to Innocent Enete, Metro Star newspaper in Nigeria. Innocent, can you hear us?
I can hear you. Good evening, sir.
Please go ahead, we can hear you.
Okay, my question